top focus story in this newscast. We are looking at the COVID numbers today amid a spurt in H3N2 virus cases. India today, in fact, registered a single-day rise of 918, a minor dip from the single-day rise on Sunday, which had crossed 1,000. Fresh coronavirus infections are being reported to the tune of 918 in terms of the daily increase in cases, which has taken the country's active caseload to 6,350. According to the Union Health Ministry data, the daily positivity was recorded at 2.08%, while the weekly positivity was pegged at 0.86%. The overall coronavirus infection tally has now increased to 4.46 crore. Earlier on Sunday, as I mentioned, a total of 1,071 new infections were reported in a span of 24 hours. The active cases now comprise of 0.01% of the total cases, while the national COVID-19 recovery rate has been recorded at a healthy 98.8%, according to the Health Ministry website. Though nowhere near alarming rate yet, but COVID and H3N2 influenza cases in India are showing a steady rise. That graph, in fact, gives you a picture of how we have covered from January to March. There has been a steady increase in the months of March and April, I beg your pardon, in March in particular. And amid this, the government held a key meeting today and has advised people to wear masks in crowded places and maintain proper hygiene to prevent the spread of the virus. 918 COVID cases were reported over the last 24 hours and an infection positivity rate of 2.08%. The ICMR has said that antibiotics should not be used unless there is a clinical suspicion of bacterial infection. Now let's put out the other graphic of the COVID status in India, where we're going to show you state-wise which are the states that have registered big numbers. Rajasthan 117 and the increase is by 17. Gujarat 740, increase of 85. Maharashtra has a daily increase of 1,308. It's an increase of 144 cases in Maharashtra. Karnataka 616 plus 39. Kerala 1,796. The number is quite high there. An increase of 41 in daily cases. Delhi 209, an increase of 19 cases on Monday. So India in all, overall, if you add up the numbers, have seen a single day rise of 980 new coronavirus cases, while the active cases, like I mentioned, rose to 6,350 as per Union Health Ministry data updated earlier today. The country's COVID-19 death toll has overall increased to 5,30,806. with 4 latest fatalities, 2 from Rajasthan, 1 from Karnataka and 1 from Kerala. Let's listen in to my colleague Deepak speaking to one of the doctors in Karnataka on the overall situation.
And H1N1 and H3N2, there are also some cases can be there, but the clinical presentation will be similar. Clinical presentation is similar. So usually we are not testing for them, only testing for this one, COVID virus. If they are negative, then only we can suspect these things. And H1N1, we have got antiviral medications like oseltamivir. So other viruses, they are there, influenza-like illness, similar symptoms, and similarly they are managed. The most important thing what we have to do is they have to make their self-isolation so that they will not spread to others. That is the only precaution. And usually immunocompetent young individuals, we don't expect any complications. Even only elderly people or people with some comorbidities, they have to take precautions.
Right, let me introduce, joining us here on the program, Dr. Subhash Salunke, Senior Advisor, PHFI and National Member of the COVID-19 Task Force. Also joining us, Dr. Rahul Pandit, who's the Chairperson of the Intensive Care Unit. Are the guests with us? I don't see them on screen. Okay, we have both the doctors with us. Dr. Rahul Pandit, Chairperson of the Intensive Care Unit of Sir H.N. Reliance Foundation Hospital, and member of the National COVID-19 Task Force as well. Very good evening, gentlemen. Thanks for joining us here on Mirror. Now, I would like to begin with you, Dr. Salunke. It seems the pattern is once again looking very similar. Kerala, Maharashtra posting very high numbers. This time, Gujarat has registered the sharpest spike as of now. from Sunday to Monday in the daily increase in cases. Is it going the same way as the first or the second wave? Is there reason for worry, Dr. Salunke?
Absolutely not. Let me clearly assure through you the entire country that there is not a panicky situation. Obviously, we have seen upward trend of the cases, but that doesn't mean that we need to be worried too much. At the same time, we know that the viral infections, including the coronavirus, or what we generally call as a COVID, undergoes the fluctuations, ups and downs of these infections do take place. We are also aware of the fact that, Jan, Feb, March, these are the months in which the viral infections do occur, and the intensity will be slightly more than what is normally expected. Mumbai, Pune, or the cities of Maharashtra are well known in this respect. So also the western states like Maharashtra, Gujarat, Kerala, and Karnataka. There is nothing unusual about it. So what we are saying and what we have discussed also at the National Task Force is a clear indication that there is nothing to get panicky. However, we have to be very, very cautious. One, about the use of masks, particularly those who are symptomatic, those who have cough, fever, etc., irrespective of the age, must use masks. And those who are senior citizens, they must use masks. It is in their own interest. It's a kind of an advisory. It's not compulsion, but they must use masks when they are getting into a situation where there is congregation, when they are going in a places where there is no proper ventilation, etc. And most importantly, those who have not taken booster dose or precautionary dose of the vaccine must take it. COVID has not gone away. It is unlikely to go away in next few months. There are fortunately very few cases on intensive care unit. There are very few cases on ventilators. The morbidity is quite low. Mortality is very low. So the people will have to take into consideration that this is a great opportunity to protect ourselves, and that one mechanism or one measure is the vaccination.
Yes.
Second measure is the use COVID appropriate behavior. So if we follow this, we will not only protect ourselves from COVID or from corona, but also from other influenza viruses. We don't get worried about this H3 and 2. I mean, obviously, with the extremes of ages, particularly children and elderly people, must protect themselves. However, it's not something where you have to get unduly worried.
Yes. Dr. Rahul Pandit, do you agree? The reason why we decided to take up this issue is, of course, because we've seen again it crossed the daily cases touched over 1,000. And that is where the first alarm bell rings that, it is steadily on the rise. The concern is whether, last time, again, during COVID, the problem that many of us faced is that here is a virus that would spread surreptitiously. We don't know who is infected. And therefore, human-to-human contact was proving to be disastrous. This time around, do you agree with Dr. Salunke that it is not as alarming at all? But we have to be cautious. COVID discipline, that is all we need to maintain. Is that what you think?
I completely agree with Dr. Salunke. There is no doubt about it. So what we are looking at is a spurt in the viral infections, just not COVID-19. It is also H3 and 2, H1N1 influenza. And we are seeing these people who are sick around you with upper respiratory tract symptoms or body ache or fever. And it's obviously very difficult to differentiate between what is the virus which is causing it. So we have obviously started testing now, and we're getting these patients positive. We do not need to panic. This is probably a seasonal change which is happening as we get and progress into summer. I'm hopeful that these cases will come down. As of now, as Dr. Salunke rightly pointed out, that majority of the cases are mild or asymptomatic. We are not having a lot of patients in the hospitals or in the intensive care unit on ventilator or oxygen, and that's a good news. However, I would completely agree that we need to keep a very, very cautious look on all of this. We need to do the genome sequencing, look at the clusters. If there are any clusters developing, if there are any new strains which are coming up, those would be the things I would actually like to then the government would follow and make sure that we study that in depth. But otherwise, sporadic cases coming across the country, we are a big nation with a large population. I would not be worried about it currently at all.
Okay, that's a lot of clarity we have.
Masking.
Yes.
Mask should be a health habit.
Right.
It should be worn by people when...
Yes. Right.
Go ahead,
I think the two doctors agree on most of the issues here. But, I want to ask you, Dr. Salunke, when we look at the map, we see the western part of the country. And since you mentioned it's a seasonal flu, has the weather got to do anything with it? Because the states that are affected are all on this side of the, of the country, where you have Rajasthan, Gujarat, Maharashtra, and on the northern side, Delhi. The eastern part is not impacted as of now. So does that have a connection? I'm just looking at the map and thinking about whether weather has a part to play in this.
Well, the weather may be a slightly contributory factor. But what is the major factor? As we know, the viral circulation in the western side of the India is well known to be a little more than what we have seen on the eastern side. And another very important point we have to keep in mind that the barring few states in the southern India, in the eastern India and central India, the health system reporting, health system capacity to report cases, to do the surveillance, to ensure that the system picks up the cases at the earliest is comparatively not as strong as we have seen in Karnataka, Maharashtra, Gujarat. So these are contributory and complex issues, but certainly weather plays an important role.
Okay, Dr. Pandit, what are we supposed to look out for to gauge the exact status? Are we to look at the positivity rate? Are we to look at the daily cases? What should be the barometer of how, as a country, how are we doing at this point of time?
I think obviously we all look at the positivity rate, but as Dr. Salunke said, it could vary from region to region. Capacity to test and report is different. But again, I would come back to what I said. If I'm seeing a cluster and if I'm seeing a new strain developing, that's when the alarm bells need to basically be looked at. That are we actually looking at a new strain coming across, which is different? Yes. The current strain, which is spreading, which is infecting people, and is it spreading at a different rate? That's where I would be basically putting my money in right now. Sporadic cases are not bothering us. Cases mixed with flu or influenza are not bothering us currently. Let us not get ourselves scared and panicky. We need to be cautious. We need to have a strict surveillance of where the cases are coming from, and is there a cluster developing. I think these are the main things, main points which we need to look at. And COVID-appropriate behavior, masking, especially for people who are at high risk, elderly. I mean, we've gone through the drill. We know the cases we know the category of population which needs to mask and protect themselves. And this is the advisory, this is a health habit which they need to develop. Yes. And it will protect them from the other viruses as well, obviously, not just COVID-19. Right.
A quick word and quick last word, Dr. Subhash Salunke, on what the government has said, that there should not be a rush to take antibiotics. What is the reason that such an advisory has been issued at this point?
It is absolutely right, because unfortunately, both people themselves and the medical community, medical fraternity need to be blamed for this. The moment I want to become modern, many doctors use antibiotics which are irrational and not needed in a viral infection unless there is, added super infection by the bacterial infection. Unfortunately, what we are going to face problem in our country more than these diseases is the antibiotic resistance. So we have seen that the very irrational use of different, I don't want to take names of the antibiotics, people know them, but easily people start saying ki chalo le lo yaar theek ho jayenge. That easily saying le lo yaar theek ho jayenge is an attitude which is deleterious for our country as far as antibiotics are concerned. So we not only at the national level, at the government of India and the state government, as a medical fraternity, I want to very strongly recommend to the particular doctors, please do not prescribe antibiotics when you are aware it's a viral infection antibiotics have no role, they don't help. On the contrary, they create problem. If you know, if you are sure clinically by laboratory investigation that there is superadded bacterial infection, do use appropriate antibiotics. But irrational use of antibiotics is deadly as far as this country is concerned, because we are going to face the challenges due to antibiotic resistance. We are facing, not we are going to face. We are facing at this juncture. That is the reason in viral infections, do not use antibiotics unless it is appropriately indicated.
Right. The distinction that you made very clear between a viral infection and a bacterial infection, which may require antibiotics, one should be extremely careful to understand that distinction. Thanks very much, Dr. Salunke and Dr. Rahul Pandit, for joining us here on the program and giving us clarity on a number of issues. Thanks very much.
Thank you.
Thank you.